This is a thumb tape job. Mechanism of injury for most thumb sprains is an abduction force, stressing the ulnar collateral ligament. So what we want to do with this tape job is approximate the tissue and restrict the movement into abduction. The athlete is sitting, elbow supported. Apply a small amount of skin toughener to the wrist and specifically through the palm, as when it's sweaty, it's really hard for it to stick. Place an anchor through, pinch, and through the palm of the hand, and then back around, and you can catch just by the carpal metacarpal joint, back around and into the palm. This forms one of your anchors. You will then use a half strip of zinc oxide and put an anchor just proximal to the IP joint of the thumb, making sure that you don't block the thumb. And one of the common problems with this tape job is they put too much tension, so it actually cuts off the circulation of the thumb. So make sure it's just laid down lightly. You then want to recreate the ulnar collateral ligament by pulling the thumb into adduction towards the anchors themselves. So you come through, and again, cutting a split, you measure, and you're going to go through the medial side of the thumb, and you're going to cross and attach the anchor on one side, and then cross and attach the anchor on the palm. You're going to continue these strips, overlapping, each one slightly moving from distal to proximal. The number of strips are specific to the person that you're taping. In other words, if they have a large hand, you may need to do 4 or 5, smaller hand, 2 or 3. What you're doing is essentially creating a cap around the thumb, and you want to make sure the cap comes down below the metacarpal joint. So this is the metacarpal joint here. So at this point, you can actually retest your tape job by having the person attempting to abduct their thumb, to pull their thumb out, and they'll feel like they can't abduct their thumb as much as they could before. And if they find that it's too loose, you can actually make corrections at this point. You then want to close and secure the ends of the strips down. And you can actually figure 8 around the CMC joint and then back onto the palm. And you just repeat that just to close around. Try and stay out of the wrist. You can do this in combination with a wrist tape job, specifically if you've got somebody with a scaphoid lesion. If the end of the scaphoid is involved and you want to block wrist movement, you can involve it there. But there's a lot of sports where you want to leave the wrist moving, things like volleyball, where you'd also want to be able to stabilize the thumb without affecting wrist movement. Make sure the tape is tacked down well. You can see that it just comes across the CMC here, but allows the wrist full movement. You can see how there's a set of V's going down on the lateral side of the thumb. And what it does is when you try and bring it out, it blocks the thumb from coming in through full range.